It's a month late, but we finally reached President Biden's July 4th goal. As of today, 70% of U.S. adults have now received at least one dose of the COVID-19 vaccine. But although vaccination rates have risen, so have cases and deaths. And now, in some states where the politics of bucking COVID guidance from Washington played well, COVID is racing dangerously ahead. Florida now has more new cases than ever before and has broken a previous record for hospitalizations set more than a year ago before vaccines were available. And despite once trailing New York by 29,000 COVID deaths, Texas has now surpassed New York. Texas now only trails the country's most populous state, California, in deaths since the start of the pandemic. All that as many are forging ahead with large gatherings. Even former President Obama is said to reportedly host hundreds of guests for his 60th birthday party this coming weekend in Martha's Vineyard in Massachusetts. Guests will be required to submit proof of a negative COVID-19 test, but some are wondering whether it should be held at all, given the current spike in cases and hospitalizations. And although Lollapalooza organizers said only attendees who showed proof of vaccination or negative COVID tests were allowed to enter the 4-day weekend concert series that just wrapped up yesterday, some have concerns about the aftermath of it, and after they've seen so many people packed into spaces and very few of them wearing masks. Joining me now to discuss is Louisiana Health Department Regional 2 Director, Dr. Don Marcelle, and Associate Professor of Political Science at Howard University, Dr. Niambi Carter. So, Dr. Marcelle, I just want to get some sense of where we are with the pandemic at this point. It feels like we're going in two completely separate directions. We have seen an uptick in vaccination rates, as the Delta variant has caused some panic and some concern, but we are still racing up the curve when it comes to hospitalization cases and deaths.
Well, the answer to the question, where are we? The short answer is we are still very much in a pandemic. And I think it's important for us to stay cognizant of that. We are definitely seeing an increase in the number of cases and an increase in hospitalizations that honestly we did not expect to see once we knew a vaccine would be available. And what we can say is that the majority of the hospitalizations are amongst people who have not been vaccinated. And so we are having an even stronger message to please get vaccinated. I mean, that is the real point here, to get vaccinated, because this virus is not going anywhere until we do our part, and that is to get vaccinated. Delta is the fourth letter of the Greek alphabet, which by definition means change, and this variant has truly changed the game. The landscape has been altered with the advent of this variant, and so we really need to take it very seriously. And for those who have not been vaccinated, reassess getting vaccinated, and also for those of us who have been, to truly consider wearing masks, even if we're vaccinated, because until we get to a certain level where the majority of people are vaccinated, the transmissibility of this particular variant is extremely high. And whereas other variants were not as contagious or easily spread amongst the vaccinated, this variant is different in that case. And so even though vaccinated, until more of us are vaccinated, it will be important to wear masks, as well as socially distance when possible, and use hand sanitizers. Wash your hands with soap and water. Use sanitizer with minimum 60% alcohol to kill the virus and bacteria. And these are the public health measures that we recommended prior to the availability of the vaccine. But until we get to the levels of herd immunity or community immunity that are required to minimize spread in a meaningful way, we're going to need to continue to do those things.
Right. Dr. Carter, I mean, I'm very curious about the idea, this is just a fact, that the public health implications of this virus has always, from the very beginning in this country, been tied up with the politics of the virus. And now you see the politics being exerted in a different way. There's, states that, that were making their whole case on bucking Washington are now seeing horrible outcomes, like Florida and Texas. But also you see some people now on the right looking at the Obama event that's going to happen this weekend, looking at Lollapalooza that just happened this past weekend, that was greenlit by the mayor, Lori Lightfoot in Chicago, both of them black, and saying, look, these liberals never cared about the spread of the virus. They only cared about, what was convenient for them. Talk to us about the politics now as the Delta variant makes this virus surge again and how things are flipping.
Well, I mean, I think the thing that we all have to keep in mind is that this should have never been a partisan issue to begin with. This is a public health issue, and public health is in everyone's interest, regardless of what your partisan stripes are. But we also have to remember that the imperative to make money for cities and other state governments really seem to trump everything that public health officials were talking about. So shuttering businesses was really frowned upon because people said, well, what about the economy? And others were saying, well, what happens if your consumers are dead? And now I think we're at the point where, again, we see on both sides of the sort of political spectrum that everyone is tired. I think everyone feels fatigued by this. And I think that sort of imperative to keep the economy humming is really what's guiding a lot of sort of decision making in these cases, whether we're talking about eviction moratoriums like you spoke about in the previous segment, or we're talking about an event like Lollapalooza, which brought 385,000 people to Chicago. I mean, that's an enormous amount of people in the middle of an entire pandemic where we know that everybody who was coming there was no way that the security was probably checking those cards and all of that kind of thing. That aside, I think it's probably at this point for everybody is reaching their breaking point, right? And because we have this vaccine, I think it gave people a renewed sense of security. It made people feel like, well, I have this. If I do get COVID, I may not die, right? It may not make me a little sick, but it won't be that severe. And I think that's exactly the wrong attitude to be having at a moment when we see that we are now surging again. And so we know this is going to be played for the Obama gathering is going to be played for political points, right? Where the right will say, well, look at what the left is doing in the same fashion that, Lindsey Graham potentially exposing Joe Manchin and others to COVID is going to be played for political points. But I think the thing that most of us need to keep in mind is that whoever is hosting a gathering, regardless of their partisan stripes, COVID does not care. Right? COVID doesn't care about what people's political leanings are. And we all have to do our part and remain vigilant. I know it feels normal to us now to walk around with masks and probably with hand sanitizer and all these things at the ready. But those are half measures, right? We're talking about trying to eradicate this virus so that we don't have to continue this way. Because again, we're at that moment where this pandemic is going to become endemic. And that's going to be a whole new set of realities that I don't think most people in this country are prepared to deal with, whether they're Democrat or Republican, conservative or liberal.
Dr. Marcelle, let's talk a little bit about exhaustion and anger. I read two stories today, one in the New York Times, about how people who are vaccinated are growing more and more angry with people who are unvaccinated because they are blaming them for the surge and blaming them for taking away freedoms that they thought that they had earned by getting vaccinated themselves. And some public health experts saying that that could actually work against getting more people vaccinated. But talk to me about, the psychology of this. Do you have to, coax and ease and sweet talk the remaining unvaccinated into getting vaccinated? Or can the peer pressure of people being really, really upset with them for this work?
I don't know that I think it's coaxing or sweet talking or pressuring them. My goal is to inform people. I want to give people the facts. I want to understand where they're coming from and how they got to the thought that caused them to decide to not be vaccinated, and what can I do, or my team, or the people who work in this field do to help people make informed decisions and give them the facts. I am truly miffed with how misinformation is embraced and spread so easily and believed, while the facts of the matter tend to fall by the wayside and seem to be disregarded in the staunch decision making where we are now, because many people who want to be vaccinated, who have access and could be vaccinated, are. So right now we are trying to get people who want to be vaccinated but don't have access. We're trying to get access for them, but it's also a matter of providing the information necessary to help people make decisions that they think are best for them, but hopefully having them realize that what's best for them.
I hate to interrupt, but I just want you to just expand on that a little bit, because it appears to me that there are a lot of people out there, they're not, it's not that they don't have the facts. They have facts, they have misinformation, they're choosing the misinformation, right? Mm-hmm. So I'm just trying to figure out, how do we get to the point where we say, okay, it's not a lack of facts. People keep putting out facts. It's just that a certain part of the population that doesn't want to hear those facts. They don't trust those facts. They don't come from the right source. They don't come from the source they trust. How do we get over that? Because I'm starting to believe that it's not an issue of educating them out of this.
Well, I do think education is a part of it, but it is definitely not the sole piece. And you actually answered some of it in your question when you were saying is talking to people that they know and trust. I mean, for the people who have a physician, a trusted physician can be considered a source, or a family member or a coworker who has gotten vaccinated. And I do think it's understanding why. I mean, what we may call a myth and say, these are myths that people believe, to that person, it is a belief. And I do think a part of it is hearing them out and respecting where they come from and listening enough to understand, to see how they got to that belief. I mean, there are many beliefs out there that I have encountered, from concerns about fertility, mistrust of the government, thoughts of the Tuskegee experiment. There are a conglomerate of factors that come together to influence why people choose not to get vaccinated. I actually divide them into three groups. You have anti-vaxxers who were anti-vaccines pre-COVID, and this is not about COVID. They are anti-vaccine. You have the vaccine hesitant, who need and want more information, and this is a large group of people with so many different reasons, and you really just have to hear them out and understand and share with them what you know, but it is not purely intellectual information, because they do have information, but they really have to think it through and discuss it and decide, and not feel forced upon, because we're not trying to impose upon anybody's rights, but it is providing you information to make the best health choice for yourself and for the community. And then there are the vaccine antagonists, and unfortunately it has been politicized, and they fall into the category that Dr. Carter described. But I would say she made a good point. I wanted to
I just want to reiterate. I'm sorry to interrupt. I have only 1 minute left. I just want to get Dr. Carter in right before we leave here. So, Dr. Carter, I just want to get your sense of, how do we turn the ship around? Meaning, getting people to embrace new habits are very difficult. It was hard on the uptake to get people to wear the mask in the first place, hard to get them to wash their hands. It was actually hard to get people to stop doing that, to take them off and say, okay, it is okay to take it off. How do we then go back to getting them to understand that this is a moving thing? Whenever the data change, whenever the situation changes, you have to change. How do we get them to get back into the mode of, okay, brace for it, put the mask back on, we have another urgent spell of this?
Well, I mean, I think one of the things that has to happen is there has to be consistency in messaging. And I think people have felt like the CDC has been inconsistent. But again, that's because this is a moving target, right? This is very much a pandemic in full swing. And I think there was a moment where we felt that there was a lull. And so people got a little relaxed as people became vaccinated, said masks off. And it's like, well, no, now there's a surge, so masks back on. And I think people need to know that it will evolve. I think it's going to also take these chief executives in all of these states to be on one accord, right? That this is something that people need to move beyond the partisan messaging about and really talk about what are the facts. As Dr. Marcelle said, the facts have been pretty much the same. They have not talked to scientists, but now all of a sudden everybody's a scientist. And I will say this, we impose on people's absolute rights all the time. And I think, whether we're talking about vaccines to go to school, many children can't go to school without vaccinations unless they have very specific circumstances. We have to wear seatbelts. We have to follow speed limits, right? There are certain things that we cannot do for the safety and health of all of us. And I think we can't treat COVID any differently than anything else. And I think another thing we have to remember is that people like to keep the things that are consistent in their belief systems. And we just have to remember that this is going to disrupt many people's belief systems and recognize that people are invested, right, in their own comfort. And this is conflicting with their comfort.
Dr. Marcelle, Dr. Carter, I will say that I am struggling myself to bounce back and forth when the tennis ball goes across the court and we go back and forth. But I am going to make it work. So thank you so much for your time tonight. I really appreciate it.